Hello and welcome all on the day one of APAC HealthTech Innovation Conclave, being supported by Dell Technologies, Microsoft, Ognito, Doxiva, and Vivio Health. I would take this opportunity to thank all the eminent panelists present on this panel, starting from our moderator, Dr. Kousar Shah, Group COO, Aakash Healthcare. Thank you so much, Dr. Kousar, for joining us today. We have with us Chandra Mouli, Mr. Chandra Mouli, Chief Information Technology Officer, Sankara Nethralaya Medical Research Foundation. Thank you so much, Mr. Chandra, for joining us today.
Thank you.
We have Ms. Mitali Biswas, CIO, CK Birla Hospital. Thank you so much, Ms. Mitali, for joining us. We have Dr. Venkat Ramana, Sudigali, Director and CEO, Excel Hospital, on this panel. Thank you so much, Dr. Venkat, for joining us. We have Tejas Deshmukh, Vice President, Doxiva, with us for this panel. Thank you so much, Tejas, for joining us. We have Professor S.N. Sarbadhikari, Consultant Digital Health, and he is a renowned digital health expert. Thank you so much, Professor S.N. Sarbadhikari, for joining us for this session. With this, I would like to hand over the session to Dr. Kousar Shah, Group CEO, Aakash Healthcare, for the moderation. Please, over to you, Dr. Kousar.
Thank you so very much. And I think very excited to run through this session with such eminent speakers who are a part of this session. And it's a pleasure. In fact, I'm privileged that this opportunity to moderate this type of a session has been assigned. And I'm sure all of us will be able to not only share our thoughts through this session, but also there will be tremendous learning for the people who are tuned in, plus all of us as well. So, as the topic says, that virtual care deployment for the future of healthcare. This is a topic which is quite a lot linked to the last 1 year, which has saw us through the COVID times. And I don't think there is a need that we need to speak about the COVID times all over again, because in the last about a year or so, every single day, every single minute or hour, we all have been talking about this. So, but for sure, the changes it has brought in our day-to-day lives has been extremely on a undescribable side. At the same time, so many professions, so many sectors, so many, even the economical situations all through the country, all through the world, has gone through a rampant change in this last 1 year. And we have not been able to come out of it totally, even despite the vaccine being there, and when the cases were going down till about a week or 10 days back. For the last about week or 10 days, we again have been seeing on a daily basis, the cases for COVID are again going up. So which actually shows that something like COVID or something like this is definitely going to stay, and we will be forced to think beyond the routine, what we have been doing all these years. And while the COVID impacted every single sector of the world and the country as well, one sector which survived this impact has been healthcare. And the very reason has been the healthcare was not a sector which can be gotten away from the COVID situation. Because end of the day, it's a medical illness, and medical illness requires healthcare. So as a result, healthcare has been afloat throughout this entire year's impact and the pandemic situation. Now, yet the healthcare practices changed. A lot of healthcare verticals had to shift a lot to telemedicine, to the virtual care, which many of us thought is going to be just for the time being. And end of the day, once the pandemic is out, we may again be going to be shifting to the normal care that is supposed to be given to the patients. That has not been the case. And we saw a lot of people are still looking forward towards telemedicine, and with the uncertainty about this particular virus, which is still available in the community, it is definitely making us to think, what next? How do we link the virtual care to the healthcare? Now, with this topic, I think the speakers who are available here, they are of a high recognition, and I would love to take their expertise on all the different topics and the questions that may be coming out of because of this particular talk. So, for example, is building a virtual healthcare environment really the need of the hour? Is that really a reason why we should be sitting here and talking about this? Is this really something which we require for the future? Now, with the type of experience that Mr. Chandra has, may I request him to put some light onto this?
Thank you, sir. Thank you so much. I think that was, I think you had put a context very clearly. I think instead of going deep into the past, what I may like to do is to really touch upon what changes had happened post the pandemic itself. I think we all know we were in a root shock when the first idea for on even a shutdown or whatever lockdown or whatever you may call it was announced. I think it was with a lot of dismay and shock that we all took it. I think we need to understand what is driving this change in terms of whether there is a need for anything digital, virtual, or whatever we may call it. I think there are multi dimensions to what we are looking at. Is one is the pandemic itself. Second is, ironically, industry itself had been in a transition, what we call it as an industry 4.0, which is an adoption of all the disruptive changes that are happening in the technology world. Things like virtual reality, things like the 5G, other things which are likely to come, cloud and things like that. I think these are things which are pretty much on the anvil for quite some time. And healthcare had been notoriously been a laggard in adopting some of those changes. And thankfully, because of the change, particularly in the post-pandemic, the government also came out with a lot of regulatory and policy framework changes. Say, like we briefly touched upon telemedicine, which had not been the case before. I think suddenly the government woke up and came out with a lot of regulatory changes, which is helping the adoption of telemedicine itself. And some of the changes that needs to happen around the telemedicine has been the issues around privacy, data protection, things like that. I think we are seeing a perfect storm, what I would call it as a perfect storm for you to adopt to a virtual world. And in the process, what we did was, we learned some two new terminologies, which has been completely been on our backup, which had been in the back of our thoughts, but we had never done it before, like social distancing. Certainly, this became a buzzword suddenly. And hygiene becomes a very important factor in whatever we try to do. I think these are two things that suddenly came out of the blue in terms of some basics. When we started, there was no vaccine, for example. So how do I bring in digital to this? Actually, that will be a subject of discussion for later. But what did happen was also a quantum shift in terms of the way the doctors felt they should conduct their practice, number one. And there is also a general disbelief about people coming to the hospital because of the infection and things like that. So suddenly the patient expectations changed overnight, actually. And the services have to be still be thought through. For example, in Shankara Nethralaya, we had operated close to around 7,000 patients, and we had an obligation to do a follow-up post-operative. But thankfully, unfortunately, because of this shutdown, I think we are forced to shut down the hospital for most of these things because for lack of a protocol, established protocol in terms of handling the pandemic. Till such time that we got to that level, I think we had to shut it down for quite some time. Nearly for around a month and a half, we were shut down. And this led to certain things of adoption of newer technologies. I think the necessity has been the mother of invention of all these things. So whether we like it or not, I think all the factors that led to adoption, I think it led to the rise of the digital itself or the virtual care. We'll go into detail on the virtual care as we really heard about from others in terms of what are all the things that we may like to do and things like that. It's just not about telemedicine itself. Telemedicine is just one of the aspects of the entire virtual care, but there are other things that has been coming around as well as the virtual care itself. I think this could require a whole day discussion itself, but let me pass it at the time for the benefit of the community at large to hear what others are saying around, other experts are saying in the panel actually.
I think you are on mute.
Mr. Kousar, you are on mute.
Sorry. So I'm going to repeat this again. So thank you so much, Mr. Chandra. You yourself happen to be, a digital strategist, and I think this has been a pretty good start to talk about this particular topic. Now, if we have to think about virtual care in providing healthcare services, what could be the advantages for the organizations? If I have to ask this question to Ms. Mitali, who herself has been an ASQ certified Six Sigma black belt. I mean, मुझे तो सोच के अजीब सा लगता है. How can somebody be so trained? I can't believe this. So educated and trained. So, Ms. Mitali, could you please throw some light on this particular part?
Thank you, Dr. Shah. So as far as the virtual healthcare is concerned, from a technology point of view, I think it has been existing for a long time. It's not a rocket science, having to do this virtually. But what COVID did was to accelerate the adoption. I think especially in India, this was quite unheard of. Both the clinicians and the patients were not very keen to adopt it. But I think what the pandemic taught us, people locked out in their homes, had no choice but to actually go for virtual healthcare. It started with telemedicine, though that's a very small part, as Mr. Chandra said. Telemedicine is just a very small part of the entire, virtual healthcare when we talk about it. It's an entire gamut of, I would say, exchanging data between the patient and the clinicians, which can lead to better clinical outcomes. Now, when we talk about the advantages, that the hospitals can offer based on this, I would categorize it into, 4 areas. So one, the entire patient experience, what this entire digitization or virtual healthcare can do is help us build an entire digital ecosystem, which would have other stakeholders, like the pharmacy companies, the TPAs, the hospital themselves, the labs, all of that, which would, of course, enhance the end-to-end patient experience. So that is number one. Number two, move from a reactive healthcare to a more predictive healthcare. Now, as soon as we talk about virtual, there comes the power of data. Virtual means, the connected health comes across. You are collecting a lot of data digitally, which you are currently probably not able to do because, we are not yet there. And as soon as you start collecting a lot of data, there comes the power of AI. And then you can predict, rather than acting reactively. So predict it more of, than reactive, which is, what traditionally healthcare has been all about. So that's number two. Number three, you can increase the reach of the clinicians. Now, for a country like India, where the patient to doctor ratio is very, less, where very few doctors compared to the population that we have, with virtual healthcare, probably our clinicians can reach out to more patients, especially in the ones in the rural areas, but that's quite far. I would say it's not going to happen very soon. But I think good that we have started, talking about it. And, the whole point that we are having such kind of session, I think is a right step towards it. And then the fourth thing I would say, it would also lead to different revenue models for the hospitals. Because as soon as you're moving, you're changing the way you're practicing healthcare from reactive to predictive, collecting the data, patients are not coming to the hospital. It's pre-ops, post-ops, a lot of things you can do. Even, when you are in the hospital. So, for example, when somebody is in ICU, there also you can collect a lot of data that is coming from the machine, where the patient is at the hospital, but the doctor is virtual. He is out of the hospital. So that's also virtual care in one sense. So there also you're collecting a lot of data, predicting, for a patient lying in the ICU, what could happen, rather than for the emergency to happen. So, if the hospitals start thinking, in that angle, start making use of virtual healthcare in all in the entire gamut, rather than just limiting it to telemedicine, I think we would probably be in the right direction. And the main reason, the main advantage that I see is from a patient perspective, which is the entire patient experience and moving from a reactive healthcare to a predictive healthcare.
Thanks, Mitali. I think you touched on a very important topic, and I definitely say that at least for me, this has been a very close topic to my heart. That is patient experience. I tremendously believe in having or giving rather a very good experience to the patient, wherever the patient goes to any organization for that matter. And I believe this particular part which you said, coming through the virtual care, I'm pretty excited to ask you, can you elaborate this a bit further?
Right. So, for example, if I am a patient, right? So I my first to the hospital, of course, would be getting an appointment. That goes digital. I get an appointment through online without even either probably asking over phone or contacting anybody, either through an app or a website, whatever the hospital is offering. I get my appointment. I do a virtual consultation. The doctor probably give me some tests. I can online probably order those tests. Somebody would come and collect those samples for me. Of course, for the ones that's possible. For some tests, you of course need to visit to the hospital. But even if you're wanting to visit to the hospital, you get an appointment done for this test. So you make sure you're landing up at a time that there is a prior appointment. There's not too much of crowd. You are able to pay online. After that, there could be some drugs prescribed, which also you can order. It would be very good if this is also integrated to your TPA. So for example, if there is a operation or a surgery that is advised, you can send all the information. So if you're collecting all the information, the reports come online, the doctor prescription is online. It's a matter of fact to just send it across. If the TPAs are also part of the ecosystem, you can send it across to them. You get it. Even the surgeries can be scheduled. So you just be in the hospital for the surgery. Even where you are in an ICU, again, as I said, there's a lot of data that you can collect and predict. And then, of course, the follow-ups, which can also be done online. So for everything, the patient doesn't need to visit the hospital for a long time. Everything is one online platform, which is, of course, the future, I would like to believe in. And that, of course, increases the patient experience, especially, people who cannot go. We are all, challenged with times in this, busy world. So I think that definitely, has a long way to go. And if you're able to do that, definitely the patient experience is going to enhance.
Doctor, you're on mute.
Very well said, Mitali. I think there cannot be a better experience for a patient compared to this what you just described. When the patient is sitting from the comforts of the home and talking to the doctor. So it has to be good. Very well put across. So while we talk about the virtual care, very important questions again which rises in our minds is the efficiency of our existing resources. Now that is a question which we need to understand. How we believe virtual healthcare can enhance the efficiency of our resource in healthcare scenarios? And I would like to request Dr. Venkat for this, because Dr. Venkat happens to be a clinician himself who has shifted to strategies and the business head positions. So I think he could be the best person to describe about this. Dr. Venkat, please.
Thank you, Dr. Kousar. Very interesting discussions, and I thank all the panel members and even more importantly, the APAC News Network and the team for inviting me. No wonder we are discussing on this topic, because this is currently a very relevant to both the clinicians, non-clinicians, and the patients groups as well. So with that in mind, what I would like to say is, just as Ms. Mitali has mentioned, virtual healthcare has actually been long since a long time, even before COVID times. But now the acceptance, the triggering, especially the patient's acceptance and the patient's experience has been much more compared to the pre-COVID era. So, in my experience, we actually are a small hospital in Hyderabad. We conduct daycare as well as laparoscopy units. And also I do myself radiology, which is which has been virtual since last 3-4 years, and I do radiology reporting for patients almost all over the world, mainly from EU and outside Hyderabad in India and also Australia. So for radiology, it has been very well established because you don't actually need the patient to be around waiting for the results. And that gives a lot of flexibility, and also you can maintain your standards in terms of your staffing levels, how you can staff your emergency radiologists, for example. You don't want one radiologist sticking for too long. And also now radiology, as an example, has been very, very specialized because neuroradiology is one thing, emergency is the other thing. So it's impossible to have all specialities just in one place. And the best thing to happen for our specialty is, teleradiology, where a specialist can sit anywhere in the world, basically nowadays. And we can send across the images to get his specialist opinion. And you can get a report within half an hour, depending on your broadband speed. So that is amazing, really. And that has been our experience, actually, because I do reporting and I send out scans sometimes within 10 minutes of my stroke patients getting scanned somewhere in Europe. So this kind of virtual technology is only possible because there has been connected networking across the world, including patients, scanners, radiologists, managers, technicians, all working together. In other words, I would say that, we as a group should have the clinicians in the front line so that we can take all our experience, all our technical knowledge, healthcare management experience, clinical experience all together, so that ultimately the patients at the end of the line will benefit and have a better clinical experience. Thank you.
Thank you, Dr. Venkat. While we were talking about the advantages that the virtual care may offer for healthcare, I'm pretty excited to ask Mr. Tejas, who believes in going to the root cause of any issue and then coming out with a solution, to understand what is your thought about advantages that virtual care may bring for healthcare.
Sure. First of all, I would like to thank all the panelists. It was great to hear your inputs because you are working at the ground. Coming from the digital side or technology side of the industry, what I first of all think is India has a very good position when it comes to adopting technology within the healthcare industry. We have heard lot things or lot many initiatives that are being going, especially in the HealthTech from the government side. And I also see that even the private players are taking the same initiatives to make sure technology is married with our traditional healthcare. So this is a good sign of where healthcare is going to be in future. With that, I definitely would like to share some of my thoughts on what are the advantages using technology. From my thought process, what I understand is, especially in Indian scenario, virtual care platforms are going to be basically setting up the first digital footprint into the healthcare. They're like your digital front door for any organization, right? The key to do that is basically to adopt a right technology, which is going to make sure that you get a convenient, accessible, and intelligent platform to seamlessly integrate within your clinical workflows. Now, there are different stakeholders within the healthcare. Doctors, definitely, they are at the center of the stage who are providing patient care, right? Implementing virtual healthcare is definitely going to add a lot of advantages. One of the advantages that I clearly see is there is going to be a lot of patient acquisition. There would be increase in patient acquisition, which in turn is going to increase the practice revenue. Any software solution or any technology solution that is going to give you a frictionless user experience is what needs to be the implementation. One thing that I would like to highlight here is avoid using technology partners who compete with your patients. Because it creates a leakage within your patient population, or it creates attrition, because they are somehow connected to a direct to consumer platform, which may not be advisable. And with use of virtual health, definitely we are going to set up a base for better population health management. So these are some of the advantages that I can quickly think of and share my thoughts.
Thanks a lot, Tejas. I think this has been pretty advantageous for all of us. All the advantages that you spoke about, the virtual healthcare and how this can impact us in the future. Now,
Right.
while we spoke about the virtual healthcare, is that the need of the hour? And we heard a lot of insights from Mr. Chandra. There's one stalwart sitting very silently, who's the digital stalwart, Professor Sarbadhikari. May I request you to put some light on this particular point, that is this really the need of the hour for the new world? Once again.
Thank you very much for inviting me to this panel discussion. And actually, the question is very nice in the sense we think that it's only the COVID-19 pandemic that has brought in this digital transformation. In fact, COVID-19 pandemic is being called as the chief transformation officer globally, the amount of digital disruption it has brought in, particularly for health and education. But even before that, actually, there were lots of studies going on from shifting the healthcare from the big hospitals to the home. There are two advantages. One is the cost, definitely. In a home setting, the cost comes down. But more important than the cost is the quality of life. So the quality of healthcare actually is far better when it's given in the home surroundings rather than in an hospital surrounding. And particularly if you look at the ICU environment, that has got a lot of issues, including psychological ones. So definitely, COVID-19 pandemic has hastened this process, and also it has made irreversible in a big way. In fact, if you look at the telemedicine consultations, after it shot up more than 500 to 800%, it did come down, but it has not come down to the pre-COVID levels. And that is what is bound to happen. So I think it is an opportunity. It's really, we should look at as an opportunity to take forward the digital transformation, to improve the quality of healthcare, increase the patient safety, and if possible, maybe also reduce the costs. Over to you, Dr. Kousar.
Thank you so much. I think pretty well said. And you spoke about a very good term that is called opportunity. Now, opportunity is definitely a word we would like to discuss further. And I think advantages that we heard from two of our speakers. And now I would like to ask once again about the advantages plus the opportunity. And you also spoke about the cost and the quality part to Dr. Venkat, because he has a very long experience of working with NHS UK. And I believe he can put, because UK is supposed to be much ahead of us in terms of technologies and the use of technologies. So maybe he can put some light on this particular part from his previous experience plus the recent experiences. Dr. Venkat, please.
Thank you. Yeah, well, I would not say that India is anywhere behind any of the countries in terms of technological advancement. For the size of the country, for the amount of resources that we have, and the varied amount of healthcare provision in the rural versus urban, for example, I think considering all the facts, we are doing really well in our own country in terms of uptake of healthcare technology. Mobile network technology has been penetrating over 15-20% every year on the go. Now, even a stall owner in a very small rural setting has a mobile phone, and he can check his smartphone, for example, for delivery of medicines, as an example. So technological wise, I think we are really right up there, in spite of all the problems that we have in the healthcare system in terms of varied distribution and accessibility problems, especially in the rural networks. But one thing I would like to say is, compared to many other countries in the world, especially after COVID, the uptake for online virtual consultation has been increasing, but I do not think that it is going to be at the same levels after the COVID has subsided as well. Because in my own experience with patients, the if there's no choice, if there's a lot of COVID around and there's a risk of acquiring infections, then only they would prefer the online part. And many of the patients would want to see face to face, at least for some of the appointments, if not all the appointments. So I would say that the graph is like this shape, where the peak of virtual consultation is at COVID, which is right now. But after the COVID has subsided, it will come to a level maybe 30-40% more than pre-COVID levels. But it would still be a significant part of our own consultation, our own healthcare systems all across the country. Some fields like endocrinology, diabetes, general physicians, pediatric checkups, routine checkups, there may be more amenable for virtual consultations as opposed to surgery, gynecology, where a physical examination and a procedure or a biopsy may be required for further treatment for the patient. So all depends on the clinical situation. The other thing is very important, in my view, is that the national digital mission that the Prime Minister is proposing in the next decade or so, which is going to transform, no doubt. Undoubtedly, there is a lot of transformation coming up. And we are at the beginning of COVID. So this timing-wise, it has been really perfect. And just imagine the level of the National Digital Health Mission for a 1.5 billion population. It's a mammoth task that we are undertaking. And we have seen the Aadhaar card developing, which was similar in scale. And I really hope that National Digital Health Mission, and as well as the health insurance that the Prime Minister is proposing, will come into place at the right time, and also involve the rural healthcare system where it is probably the most needed. And combine all these together, digital technology, universal access for high quality treatment, not just medical consultation, but also high quality treatment for the people who are needy, especially in the rural healthcare networks, and the healthcare insurance network that we are developing. All these three together will, I'm sure, go a long way to improve the healthcare system of our country. Thank you.
Thank you, Dr. Venkat. Pretty well put across. You really spoke well about how the rural development may be linked to the virtual care, especially for the future. And I think full appreciation to the government and the authorities, the way in which they responded to ensure that the virtual healthcare platform is appropriately placed and the processes are developed. Now, despite 40 years being there for the virtual care plus the telemedicine to be there in the entire world, this was never developed in healthcare verticals. Only because of this particular time, this could see some light. And the immediate movement from having no process to a lot of processes from the government side has really been pretty helpful to all of us. Now, talking about the resource management and enhancing the efficiency, which Dr. Venkat, you also touched upon, I would again request Mr. Tejas to say something about this, please.
Sure. I think a lot of other speakers, Dr. Chandra and Sarbadhikari sir, actually touched, like, COVID has been the accelerator. Like, it has played the role of accelerating adopting the virtual platform. But one fact that I would like to bring to the notice is virtual care, or basically doing telemedicine, is just one part of the component. There are different components that will come along with the digital adoption. So, for example, if the new age virtual consultation applications have a smart triaging feature. So based on your symptoms, based on your medical condition, it will tell you whether you require a telehealth, or it can be managed using telehealth, or you are required to go to urgent care. So all those components, when added up, like ability to do scheduling, right? Online scheduling, Dr. Mitali touched based on, right? A technology that is going to manage your doctors and all your healthcare providers' calendar with respect to their availability. A technology that is going to pull in all the key stakeholders within healthcare, apart from doctors, right? To ensure proper care has been provided. Is going to add on to a lot of efficiencies within the entire operations. Coming to another point is there are a lot of routine or repetitive tasks that are required to be done. So technology at this moment has a lot of capability to do it with an automated approach, right? Taking digital index like capturing the medical history and a lot of other symptom-based details from the patient. That is going to reduce a lot of time the doctor is going to put into the administrative work, like the documentation part of it. All those things are going to definitely increase the efficiency and reduce the overheads, like physician burnouts. So all these things definitely are going to provide the best experience to all the stakeholders, whether it's a patient or it's going to be a doctor or any other allied healthcare provider, right? See, at the end of the day, virtual care is not going to replace in-person care. It is just about providing continuous care to the patient, which he requires. Whether it's a pandemic situation or post-pandemic situation, the care is required.
Thank you, Tejas. I think you said this very rightly, that virtual care will never replace the real care, which is like patient to patient, patient to physician. So this actually makes me think about a joke. During the pandemic times, one of the doctors calls up to his psychiatrist friend, who is of course also a doctor. Yeah, I'm going through severe depression because I have not been able to meet any of my patients. I'm only doing the teleconsult. So
Right.
that is the other side of the story. That was on a lighter side, basically. So extending the discussion, we understand there are basically a lot of models available for virtual care, telemedicine, and all that we are talking about today. Now, none of us know which is the most ideal model which any of the hospitals would, or most of the hospitals would like to have. And at the same time, the cost also varies a lot from this to that. So with the Mitali being, or rather, I would like to push this to Mr. Chandra, in fact. So, Mr. Chandra, you being from the same industry for a long time, in fact, and super expert in this, can we have some understanding about what could be an ideal model as per your understanding based on your own, Reiki, and of course the real understanding about this particular part, and what could be the ballpark figure in terms of cost?
Yeah. I'll touch upon this because we also help many other hospitals in this area. But before we I answered that question, I just wanted to supplement my thoughts about some of the previous discussions that happened in the digital and the cost and the efficiencies and things like that. I wanted to share our recent experiences on that. One of the things that we really see post-pandemic is the acceleration of AI into this entire stream of things, particularly what I call it as democratizing screening. I think Dr. Venkat did touch upon radiology one way or the other. I think there are other similar examples outside of radiology, which is in ophthalmology particularly. We have been front-ending a lot of stuff around diabetic retinopathy. I think it's been asymptomatic like most of the COVID cases. I think this could be another extreme example where we can really fast-track digitization, digital in many ways. Again, going back to the cost aspect of it, that will be literally as close to a zero, possibly, actually, because that will be very, very transformative, because such kind of super specialty services are not available right now, even across the world. Forget about the India itself. I think even across the world, getting a diagnosis for diabetic retinopathy, you'll have to necessarily travel. And there is a shortage of resources who can really screen and tell you all that stuff. I think there are a lot of changes that are happening. So cost is a key component to this whole stuff. Scale is another key component to this whole stuff. Then you bring in technology which can really transform experiences like what Mitali was talking around. I think there's a lot of benefits coming around all those things. Again, touching back to the idea of cost and what will be the right things for us to do and things like that, I can give you 2-3 examples of what would be a blended cost or what could be a right cost. When we really started the telemedicine itself, actually we had started doing for the post-operative counseling. So it was as part of a package. So obviously there was no charge to that. We did around nearly 10,000 of them in less than 2 months. Pretty much obviously everyone was happy because it was completely more or less remote, and I think that was completely on an autonomous mode. I think we brought in a lot of efficiency and customer patient delight in this whole exercise. But having crossed that limit of around a couple of months, actually then we started charging. Obviously, it is not in the same levels that you may probably do it when you are before a hospital facing a doctor, because this is more or less, you need to know the patient well enough for you to do that. Since it's a virtual care, we brought down the cost at least by half to what they may do from an in-person visit. But the intangibles are quite high. To give you quite a remarkable example of the cost saved that we did in the pandemic times, our study says close to around 6,000 rupees is what a patient spends outside of Sankara Nethralaya for a visit to what they may spend on Sankara Nethralaya, which may be, assuming it doesn't exceed 1,000 rupees per visit, they're going to spend 6 times more the cost. So that's the quantum saving for a patient, to do a telemedicine itself. But we also realize that telemedicine itself, rather a telecounseling, what we probably, for lack of a proper word, we extended the services with some very comprehensive eye examination, which we have done along with some of our partners. Actually, we are tied up with Titan Eye in few cities. You can walk into a Titan Eye store, get your eyes comprehensively checked up. Then the entire data is available through a private cloud into Sankara Nethralaya, and you really call back the patient on demand, actually. Or you triage it to the right doctor based upon their availability and things like that. Again, it's nearly half the price what we may probably do in terms of a physical visit. So the patient is definitely benefited by use of a technology, bringing in quality care at a remote place. It depends upon the nature of the service, the extent of complexity, things like that. But these are largely for an outreach in the first place, or in terms of a follow-up, or like what Dr. Venkat said, in certain specialty areas which require some kind of ongoing compliance checks, actually. But this is not like, no, it's not going to replace a doctor visit, or no, it's not going to be at the cost of not coming over to a hospital completely and things like that. So it just complements your core business areas. And from an examination, from the way in which we look at the efficiency part of it, many doctors are now so accustomed to using telemedicine now. They schedule their hours early in the morning, or bunch it together during the lunchtime or post evenings or things like that. So it's a lot more convenient for them to see it together in one go, maybe less than half an hour or so. They just complete all the patient visits. So we have seen a lot of shifts happening in some of these practices. So it's a lot more convenient for the doctors as well. So it's just adding to the revenue, definitely, for sure. Through an incremental revenue, I wouldn't say it's a great revenue. Certainly an incremental revenue for the hospitals, definitely.
Thank you, Mr. Chandra. And I think hats off to you, the way in which you have developed this entire network of virtual medicine. And
Correct.
I think it's a tremendous response as per the available circumstances. And again,
Right.
full marks to you and your organization for that.
Thank
But I'm
you.
sure not every organization would be as lucky as yours, because the organization size matters a lot for the organization to respond to this scenario. And with this robust system of having a good virtual care available in hospitals, while the bigger organizations were able to handle this and respond to this just like the way yours did, very, very nicely, efficiently, I'm little worried about the smaller hospitals. There are so many hospitals which may be just 10 better, 25 better, 40 better, which I know that for sure suffered tremendously throughout the pandemic scenario. They did not have the staff, they were not allowed to take the patients because of the bed size. They were not at all able to afford the telemedicine in the right manner or the virtual care also. So in that context, Dr. Venkat, what would be your thoughts about this, how this situation can be better dealt with?
Yes, you made a very relevant point for discussion, and I appreciate the fact that you have opened up this topic. Now, India has got so many hospitals, small, large, budget-wise, small, medium, high-end hospitals. Then you have patients also choosing to go to their own doctors, their own hospitals, their own local network of hospitals. Some don't want to go to big corporate hospitals either because they are scared or they can't afford. So it's very important to understand the system and support one another. I know we are all having hospitals at different stages of competitions, but at the same time, the pandemic has demonstrated that the healthcare system itself is at risk, and no wonder many small hospitals have shut down because they could not sustain themselves. The staff, they could not pay the staff, they could not afford PPE kits, they could not pass on the cost to the patients. There was a huge problem actually. Virtual consultations can happen, but again, the market for virtual consultation can be limited only to OPD, which is very small portion of what the healthcare system can provide. But the bigger issue was, inpatients. How do you handle? How do you provide PPE? How do you ensure your staff being safe? The cost of disinfectants, the cost of extra things that you do to keep your patients safe and also your staff safe. That has been tremendous things to consider in this pandemic. What I would suggest is the government should actually come in and do a lot of support. They should have a network, a support system where they can provide, basic subsidies, because we are still charged like any other shop in terms of commercial activities. We are still charged for electricity, water supply, etc., as just like any other industry, which I think is really very, very bad situation, because we are providing healthcare service, we are adding to the economic and the social impact to the nation. So we all should fight for a system where the government is supportive and incentivizing us, especially in difficult times like these, to provide us with tax breaks, for example, to provide us with breaks on the costs, the commercial costs. At the moment, I don't see any difference between the industry of healthcare compared to the other industries in general. So government really has to come up with a stringent plan to provide long-term support to the doctors, to the clinics, to the small hospitals, to the medium-sized hospitals, rural and urban, so that the healthcare system can thrive in general and provide an excellent quality care to all our patients, regardless of whether they can pay you with large bills or whether they can't afford such a large bill. So we all have to, come together to show this thing to the government, and then hope for support in the future and in the long run. And pandemics will occur. This is only a beginning pandemic, let us say. But again, in 15, 20 years, there might be another one. We should all be prepared at a grassroots level when this happens. That is all I feel. Thank you.
So great thoughts, Dr. Venkat, once again. And I think you raised a very important point that the government must come forward to help these small nursing homes. Now, I see another advantage of this. The channelization of healthcare, especially in the rural areas, can very well be done if the government comes forward to help the bigger centers to maybe get aligned with those centers through the telecommunication, or the virtual centers being developed there. And this can be a win-win situation for the patients there, and of course for the smaller nursing homes as well. So I'll give an example of the place where I am. For example, I'm in NCR, Delhi NCR. Delhi NCR, the moment you drive out of Delhi NCR area by about 30 to 45 kilometers, you see a tremendous change in the healthcare scenario. Unbelievable changes. While Delhi is filled with healthcare to the topmost levels, too many of the centers, just about 35 to 50 kilometers outside Delhi, and when you look around and when you talk to the people in those rural areas, what happens to you if you're ever faced with a situation which requires a medical emergency? They have nothing to say. The primary healthcare systems is just not appropriately developed there in those areas. And the smaller nursing homes, they have no clue how to get connected with the bigger centers or how to get the right opinion for a difficult case there itself. So I think you said a very right thing. If the government thinks about this aspect, this can be a win-win situation, not only financially and economically for the smaller nursing homes, but also for providing care to the people who really require in the interiors, or even the centers where the nursing home is the main center for them to get the care from in the immediate neighborhood. So very well put across, Dr. Venkat. So Mr. Tejas, you, while discussing the previous points, you said that the virtual care is definitely a very good thing, and there are so many advantages around this. At the same time, this cannot be a replacement for the real care. Right. Now, this perception continues to be there in most of the patient's mind, and you said this very well, in fact. And so, my thought is to discuss with you how do we handle this, because most of the patients really believe the real care is by seeing the patient in person. Even today also, I'll give an example of my own organization. So during the COVID times, when the pandemic was there at the peak, while we were doing the virtual care and the telemedicine and everything else, we were just having a footfall of in the OPD just about 150 to 200 per day, which was pretty less compared to the previous times before the COVID happened. Now, just after the COVID has subsided a bit, let's say from the month of Jan, this footfall in the OPD has multiplied. This has actually crossed to the normal level also, which used to be before the COVID times.
Right.
Now we are having a footfall of around 700, 800 patients per day. So what you were saying is up to, a large extent, very true. But I would like to hear from you, what can be the advantage that can be communicated to the patients for a virtual care, and how do we deal with this?
Sure. I think what my thoughts, basically where my thoughts resonate are, this is going to be a two-sided approach. One, I see there is a pool of modern patients, okay, who actually look for convenience. So convenience of healthcare, which is similar to like doing online shopping, right? At the same time, they are ready to pay shell out more money to make sure they get the healthcare at a bet, which is providing the same quality that they are going to expect at the clinic. That is one scenario. Second scenario is that I truly see is from the hospital side, or from the provider side, where we can proactively define certain non-emergency situations or certain consultations or certain episodes which just require any visual examination or really does not require an in-person thing to be listed as something done via virtual consultation only. This will have a right balance of using technology while ensuring the foot creating a lot of burden onto the existing ecosystem. That way we can definitely leverage the potential of technology. Also, I mentioned some time back is when you consider virtual care as a piece or a component of a technology, you also need to understand that technology has a potential to do triaging. So when I say triaging is based on the symptoms or based on the medical condition, right? It should be able to funnel patients into different categories, whether this patient can be handled using teleconsultation, or he requires an in-person, or he needs to be put into urgent care or emergency. Once that funneling is done, we would be in a better position to utilize our resources. while maintaining the accurate balance and ensuring the best care is provided to the consumer. So at the end of the day, how I see the modern patient when I coin the term modern patient, right? He wants the convenience that he is experiencing into other industry. So the same convenience is something they are expecting in healthcare also, right? For example, managing any chronic condition, like doing a follow-up for a diabetes, or doing follow-up even for a routine gynecology, does not require in person, especially when we know these are the vulnerable population that could be potentially getting infected or exposed to the COVID. So all this scenario, actually, when you understand or when you consider this, there needs to be absolute balance. All the key stakeholders need to define what exactly the implementation is going to be done. And definitely, patient has one thought process that yes, in person is something that really connects me with the doctor, but it's not always, right? There are pool of patients, especially in tier 1, tier 2 cities, who look forward for a healthcare which is more convenient over cost.
Thanks, Tejas. And this, in fact, makes me share an experience which we went through this pandemic times. So we had developed not a real tool, but we had developed a process where any patient who would be calling us for an appointment or with the illness discussion, our doctors were talking to the patient that do you require, as per the symptoms and what is being shared from the patient side, does the patient really require only teleconsult, only video consult, only virtual care, or is the patient's clinical condition is such that the patient requires to be in the hospital? Which is something which I wish this is something which is available in some software. So once it is available in some software, this can be pretty helpful for the patients also to take a decision. In this scenario, do they really need to be with the doctor, or can they just be doing the teleconsult? Because currently they are dependent on the doctor to say about this, or they make their own choice, which may not be correct. So what do you say, Tejas, about this part?
Agree about that point. In fact, Doxiva is one such application which is working as a virtual assistant to doctors. So the name itself is Doctor's Intelligent Virtual Assistant. It was predominantly built with a thought process that it is going to support or assist all the healthcare providers within the healthcare ecosystem. So any technology has the ability to gather all the medical symptoms, do the triaging. All the technologies has already been in a position that it is already advanced. The only important thing is how we integrate with the clinical work in a healthcare system.
Yeah, true. So Mitali, while you were talking about the patient experience, which is exciting for me, I'm sure for most of us who are handling the patients in the organizations. One thing which has come many times during this entire times when this virtual care and the telemedicine is happening, a patient quite a few times has complained that the prescription which was given to the patient was little different from what was told to the doctor side. So basically, it could be a misprint, it could be anything else. So this causes a lot of patient dissatisfaction. What are your thoughts about this particular scenario, and how do we handle this better?
Okay. So I think we are all in an industry which cannot afford to make mistakes, right? I mean, because it's a question of somebody's life and death. But having said that, we are all humans, and errors can happen. It could be a technical error, it could be a human error. Even not virtually, even there could be mistakes happening when the doctor is doing a normal consultation without virtual, I mean, face-to-face consultation. But when you come to it virtually, I think what is we talked about patients' apprehension of adopting to this virtual consultation. Even clinicians have this apprehension. So when I talk to the doctors in our hospitals, even they are not too keen to practice telemedicine. They also prefer a face-to-face consultation in most of the times. COVID has of course forced them to adopt it, but I think it is similar to what the patients were also forced. Even the clinicians were also forced. Even given a choice, most of the clinicians would like to see the patient face-to-face and not virtually. So what is needed, I think, and Dr. Venkat also touched upon it, there is some standardization and guidelines needed from the government, because right now I don't think those are very clear. So, for example, what kind of diseases you could consult virtually, what kind of drugs can you prescribe when you're doing an online consultation, how do you kind of administer those drugs. So I think there is a lot of guidelines, or those kind of things needed from the government for the clinicians, because the clinician is also, they are afraid of medical legal cases. What if it is somehow interpreted in a different manner? Because not all the patients are very tech savvy, whether the patient is also sharing all the inputs that are needed for a doctor to make that prescription. That is also not very clear. So I think a lot of guidelines are needed, because the clinicians are also, we never talked about the clinician. I think the whole focus has been how the patient experiences, but I think the whole clinician alignment is also needed in this virtual care, and a lot of effort from the government who get also the clinicians aligned. They also need to practice it without being afraid of any legalities around it, which I see is there a lot amongst our clinicians. So I think that is a lot of clarity that is needed around the security of data. Of course, this National Digital Health Mission, that's already in a draft stage. A lot of things are already there, but I think it will take some time to probably put it in the form of laws, and also make sure that the hospitals adapt to it. So either there has to be certain penalties or some tax benefit, something the government must come out with, so that the hospital starts practicing this. So I think that would be very much needed before standardizing across all these virtual healthcare practices.
Thanks, Mitali. And I think, again, you were right to say about the various laws coming in place, which is definitely the need of the hour. And with this, this makes me think that, yes, many patients have spoken about the confidentiality, that they are not very confident about the data that they are sharing with the doctors through the virtual care. What is the confidentiality about this? So while USA has got HIPAA, which is the Health Insurance Portability and Accountability Act, we are still missing on that. So I would request Professor Sarbadhikari to speak about this particular part, and how do we cover it up, how we can hasten this process.
Thank you. Before I answer this question, I'll respond to the earlier thing. Actually, the government of India did publish the telemedicine practice guidelines during the pandemic, way back in March 2020, and that was duly notified by the Gazette of India in May 2020. And there, of course, there are a lot of guidelines. I mean, outlines are given for what are the sort of cases which can be consulted. It could be the first time, it could be a follow-up, it could be an emergency. Who can initiate? All those things are quite clear. Even for the prescription part, the e-prescription format is given there as an attachment. So definitely, I mean, that is a good starting point. It's definitely not perfect or ideal at this point of time, but it's a very good starting point, and I think all doctors should refer to that. The other thing which has happened, I mean, as a part of it, it was said that within 3 years, I think, or so, I mean, the National Medical Commission is planning to come out with the accreditation. I mean, the doctors have to be trained for telemedicine consultation. Right now, they're not offering any course, but they're in the process of development. Like NIMHANS had helped in developing a course for mental health for telemedicine practice. So that sort of thing. And of course, Telemedicine Society of India, we had also got engaged in giving sort of awareness programs last year during April, May. But that, as I said, is evolving, and definitely we'll get into it. Next part of the patient data privacy. I think the National Health Policy 2017, in the third edition, had talked of setting up the National Digital Health Authority. Of course, it's yet to be set up. But meanwhile, the Personal Data Protection Bill is in the Parliament. It was put to the Parliament even before the pandemic. And then the Joint Parliamentary Committee has been examining that, and they have done a very extensive stakeholder consultations. And even officials from Google and Facebook and the lot were invited for the stakeholder consultations. And they have suggested, I think, more than 60 changes, which are being done now. And in fact, it will be, once the changes are completed, it will be put to the Parliament again, and hopefully it will be passed once it's passed, it will become the Personal Data Protection or the PDP Act, and that will be applicable for anything related to digital health. So yes, again, there are issues, and only when the act finally comes out, we really know what is the good part of it, what is the not so good part of it. But as of now, that is very much there in the Parliament, and we hope it will soon become an act. Till then, of course, the IT Act of 2000 is the only act or law governing the anything digital.
Thank you so much.
I just want to add, I think Dr. Venkat really touched upon this National Digital Health Mission. I think one of the key foundations of National Digital Health Mission is also about a consent-driven architecture. So the whole notion of a privacy is in the hands of the patient, actually. I think for the first time, I think you can come out with your own terms about providing a consent for a particular event, or for a particular consultation, or for a particular period, or even right to forget. All those things are on the anvil. So this will be very, very transformative from unlike other things. I think maybe not in the speed at which we are trying to look at it, but I think there are a lot of very, very transformative ideas which are on the anvil. I think once it is in place, I think we will be ahead of most of the Western countries in terms of understanding about privacy and protection and things like that. I think we are going for a sea change, like what Dr. Venkat was saying around the National Digital Health Mission coming into the picture. Next 5 years are probably going to be the best years of Indian healthcare or health tech in terms of innovation.
Yes, I think that's a very good point. In fact, the National Digital Health Mission has put up the National Health Data Management Policy. It's of course a policy, so it's not a binding one, but it's already there in place. And the binding law, as I said, it will be the PDP Act whenever it becomes functional.
Correct.
I think very good insight provided by Professor Sarbadhikari. And the act that you spoke about, that definitely has come up in the last year, March. But the issue is it has not been implemented appropriately. I have not received any single communication from government authorities to speak about its implementation. Now, unless this does not come from the authorities like the way they ask for the other compliances, this I am not very sure, because then this is totally left at the discretion of the healthcare vertical or the hospital to implement this in the right manner or not to implement this in the right manner. So I think that is where the government has to think about, because this is going to stay. For sure, the virtual healthcare and the telemedicine and everything related to this is going to stay, and may not be as much as it happened during the pandemic times. But in some or the other form, this will stay, and this may cause any type of an issue in future as well from confidentiality perspective or any such perspective. So I think this is all I would like to discuss about for today. And I think this has been really, really a great session with all of you. A great thought having been shared by all of you, great thoughts, great views, and a great plans being shared by all of you from your perspective, from what we expect from the government perspective. And it has been a tremendous platform. So towards the end, I would definitely like to say that, again, what Professor Sarbadhikari also touched upon, virtual care is indeed going to stay with us, but it is in a very, very infancy stage right now. To take this to the next level, we have to take a lot of actions, and I think the practice and the training has to initiate even at the medicos level when they're in the medical colleges. While the organizations are doing some training, as you spoke about, at their level, the medical training should become very, very stringent towards this part, so that when the medicos come in the world of healthcare, they would be knowing what it is about. We all know what problem we face. It was only because of this adversity that our doctors shifted to this as a practice, else they would have never been comfortable to this. So that comfort would come if our medicos, if our medical students as of today, they are trained on this in their medical colleges itself, and then the future will be totally different, along with the statutories coming in place, which will be implemented as well. Thank you so very much. And anybody would like to say anything else, most welcome for that.
I would just like to mention one quick word, if there's a couple of minutes time. So we are all, I'm glad that, we are meeting up with all the eminent panelists who are well versed in their own fields. what I feel is, we all need to come together, clinicians, the technologists, the managers, the CEOs, everybody should come together and put the clinicians in the frontline for any virtual or digital technology to develop to an extent where patient actually.
I think we lost him. So while we are waiting for him, I have one last comment that I would like to make here. Um, the most important part of this entire journey of making healthcare a digital enabled ecosystem is don't look at virtual care as one of the transformation. It is just a component. We have to think holistically where all the stakeholders are going to be taking responsibility of providing continuous care enabled with technology. That's how we will definitely have an ecosystem that will be uh, like a frictionless, when I say frictionless experience for everyone. Yes, Dr. Venkat, we lost you.
Yes, we can hear you, Dr. Venkat.
Yeah, so just a quick word before I go back to my Wi-Fi is a little bit weak over here. What I'm saying is all the eminent panelists and of course groups such as our group should come together, put the clinicians in the front line for any technology to deliver the results, which is high quality patients care, which is the ultimate aim for all of us. So what I feel is we should all work together as a group so that the patient care is the winner at the end of the day. Thank you.
Dr.
I
Kousar,
think
if I
that's a
can
great point.
add a few things, actually, what we are really going to say in the years, and there are a lot of trends towards that, is a move towards creating a lot of ecosystems, the digital ecosystems. I think that's inevitable as we really think about it. So we may think like the teleradiology network or a tele-ophthalmology network, or all those things are quite possible. I don't think those are going to be facts of the reality, because we are having a lot of practices which are very small at this point of time. There are not too many big hospitals which can provide you care. I think it's important for the community to work together, like what we heard from Dr. Venkat, is to build a trusted network which can provide a lot of exemplary services to the patient. So where the patients really gets benefited by high quality care through better technology. I think that's bound to happen. That's inevitable. The second thing is what we cannot wish away with is the rise of commerce into this whole stuff. Because when something going to be as good as being free or negligible, I think then you are the product actually, and that's what we have seen in the digital world. I think we are likely to see those kind of emerging scenarios coming into the picture. I think there is no other reason why the likes of the Amazon and the Reliance are jumping into the e-pharmacy world, where the telemedicine is being bundled along with some of these areas. Actually, this is bound to happen. I think we have to adopt some of those stuff as well. And then last but not the least is the focus on data actually. See, what we are also seeing from the government is they wanted to leverage data to a larger extent, where the data interoperability and other things becomes a given thing. I think with a lot of adoption of standards, something like SNOMED, CT coming into the picture, I think these are things which are bound to be a sea change, where you can do real-time interventions. The unfortunate scenario today is, no one has in India doesn't even know how many practicing doctors we have, or how many patients really come to on a daily basis and things like that. I think these are things that we can really see a change in the day over the next 4 to 5 years, as we really see some of these ecosystems coming into the picture. I think net, I think we are going to see a lot of innovation in and around the use of digital technologies and leveraging data.
Yeah, I think that's a very valid point. In fact, health data literacy is really the need of the day. And definitely, unless we're health data literate, we cannot really transform digital health in the way it should. And of course, as Dr. Kousar rightly said, you have to catch them young. All health professional educations right from the beginning should be made aware of that there's something called digital health. The days of pen and paper are almost gone.
So I think over to Gopi.
Thank you so much, Dr. Kousar, for moderating this session so well. I think it was really interesting one, and we discussed a lot of important issues. And as Professor Sarbadhikari rightly said that we should take this as an opportunity for digital transformation for healthcare, and we need to catch the young medical student needs to be, we need to give them a training at a very initial level for this digital transformation and all. So I would like to take this opportunity once again to thank you all for joining us for this session. We believe that integration of healthcare with technology is playing a very important role during the divide and improving the patient services, declining cost margins, and leading to efficiency in operational performance. So just the only aspect has important which we wanted to discuss is that the technology which is affordable and accessible can go a long way. So this is from my side, and I think I would like to thank all of you once again, to our moderator Dr. Kousar, Shah, Group CEO, Aakash Healthcare, for moderating this session so well, Mr. Chandra, Chief Information Technology Officer, Sankara, Nethralaya Medical Research Foundation. Thank you so much. Mitali, Biswas, CIO, CK Birla Hospital, Dr. Venkat, Ramana, Director and CEO, Excel Hospital, Mr. Tejas, Deshmukh, Vice President, Doxiva, and Professor S.N. Sarbadhikari, Consultant Digital Health, for joining us for this session. Thank you so much. Stay tuned for other sessions. We'll be coming up with a lot of panel discussions for next 2 days. Thank you so much for joining us. Thanks.